Do you need help with marketing, new clients, or online reviews? Massage Book is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Plus, sign up now with code ABMP50 and get $50 off after your free 30-day trial. Visit massagebook.com, create an account, and transform your practice today. That's Massage Book with code ABMP50 for $50 off. Don't wait. Give it a shot today. Calling all anatomy lovers. Embody U's 6-day hands-on fresh tissue cadaver dissection is back. Join founders Ann Teachworth and Allison Wesley in an exploration of what you're really made of. What makes the Embody U dissection lab so special? Explore tissue textures and layers through hands-on dissection, then integrate those insights into your own body with movement embodiments. The lab is held at the Institute for Anatomical Research in Colorado Springs. Get $200 off with code EMBODYABMP. Visit embodyu.net. That's embody, the letter U.net. Anatomy Trains will be holding our flagship Anatomy Trains Structural Integration ATSI training in beautiful Vancouver starting September 16th, 2024. Progressively build your anatomical knowledge, hands-on manual therapy techniques, and most importantly, seeing and understanding postural patterns and developing strategies tailored to individual needs. We warmly invite you to apply today and bring your bodywork career to the next level. Visit anatomytrains.com for more.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks.
Today's topic is a bit of a stumper for me, and it goes like this. I have a client who has severe epistaxis. We've been doing craniosacral mixed with myofascial and occasionally some neuromuscular intraoral work. Originally, she came to me for TMJ, and at first I didn't think much of the nosebleeds. After I did some further research, I decided to put our sessions on hold until she gets a nasal endoscopy. Her right nostril was cauterized about 8 years ago, but she still gets nosebleeds at least once a week. They have decreased from 3 or 4 times a week that she was getting before we started working together. Prior to seeing me, they could last anywhere from 4 to 30 minutes and happen during the day. Now they only happen at night while she's sleeping, and she's aware when they're coming on because she can taste the blood, which causes her to wake up. Any suggestions? And I replied that without further information at this moment, no, I have no other suggestions. However, I will say that kind of drop in the frequency of nosebleeds is pretty remarkable. Without more knowledge, we can't necessarily attribute that to massage, but it is a striking correlation, isn't it? And then I did some digging. And frankly, I didn't find much, but I did find some things, and I uncovered a topic with some nuance and controversy, so that was fascinating. You just never know what you're going to find. You have probably had at least one nosebleed. Almost everyone does at some point. Mostly they're mild and self-limiting, and there's no need to seek medical assistance. I don't typically hear about people seeking out massage to help with their nosebleeds, But it sounds like this client was looking for help with TMJ disorder, and the epistaxis, the fancy word for nosebleeds, was a side issue. And it just became more interesting as things began to change. So, to prepare for this episode, I looked up some information about nosebleeds, and then I looked for anything to link nosebleeds to TMJ disorders, and then I looked at whether or why massage therapy might have any impact on nosebleeds at all, and this is what I'm going to share with you now. Let's start with epistaxis. This comes from Greek word roots, epi for upon and stasian, to drip. So epistaxis literally means dripping upon, which is descriptive. Nosebleeds are usually caused by trauma, or dry air, or high altitude. But other causes can include allergies with a lot of forced nose blowing, because that's really a type of trauma, using blood thinning medications, having a deviated septum, and also having a history of inhaled drug use. There are a few more serious factors in chronic epistaxis, and we will revisit some of those in a bit. Lots and lots and lots of information is available on nosebleeds from a medical point of view. I will happily save you some time and summarize it by saying that the nasal sinuses have an extraordinary amount of blood supply, much of it in the form of extensive and extremely delicate capillary networks. This allows for some important functions. We can make mucus quickly when we need to, and this helps to protect us from pathogens and contaminants because when they get caught in the mucus, we sneeze or blow them away. And it also means that air can be warmed and moistened on its way to the lungs. We have a structure called the Kieselbach plexus, which is on the septum. Sometimes it's called Little's area. The Kieselbach plexus is a large capillary anastomosis. To get a picture of this, take a moment, if you would, and touch all of the fingers of your left hand, which right now stand for the arterial side of your systemic circuit. And now take all the fingers of your right hand, which now stands for the venous side of your systemic circuit, and make them just touch at the fingertips. This arrangement allows for a high volume of blood to contact many local cells and to move from one side to another pretty quickly. The arterial supply to the nasal cavity is often described as the anterior and posterior portions. Most ordinary nosebleeds that are caused by trauma, including nose picking or banging your nose or very dry air, these involve blood vessels in the anterior portion of the nose. Posterior nosebleeds are often much more serious than anterior ones. They can be harder to control. It's more likely that blood will run down the back of the throat. This can cause respiratory distress and aspiration. I found a nice illustration of the nasal sinus blood supply and the Kieselbach plexus on Wikimedia, and I have shared that and a link to it in our show notes. Nosebleeds are almost always successfully treated with sustained pinching of the nose for 15 minutes or so, although sometimes they can go on for longer than that. I was interested to see that, contrary to what I learned way back when, the advice now is not to tip the head back because this can allow blood to run down the throat. Instead, people are told to elevate their head, lean forward just a bit while they are pinching the bridge of their nose. If that alone is not sufficient, then it may be necessary to cauterize the site of bleeding or to pack the nose, or, and this is among the more extreme versions of treatment for repeated nosebleeds, we can embolize the involved blood vessels. On their own, nosebleeds are usually not a big cause for concern, but sometimes they can indicate some possibly serious problems, especially when they are frequent, which makes me think about today's client. So these serious problems might include high blood pressure, and we'll get back to that in a bit, or blood clotting problems like hemophilia or von Willebrand's disease. Von Willebrand's disease is a subtype of hemophilia that affects females. Nosebleeds could be a sign of liver damage that causes a shortage of clotting factors. Nasopharyngeal carcinoma, that's cancer at the back of the throat, is another possibility. And there is a genetic anomaly that can cause a lot of nosebleeds as well as problems elsewhere, which is called hereditary hemorrhagic telangiectasia. Ooh, I want to say that again. Hereditary hemorrhagic telangiectasia. Let's focus on that just for a minute. HHT is a situation where a person grows an abnormal number of tiny blood vessels in the mucous membranes, the skin, the brain, the lungs, many other locations. And these networks of tiny blood vessels can break and bleed really easily, and this can lead to substantial blood loss. Here is how the Johns Hopkins website describes hereditary hemorrhagic telangiectasias as it affects the skin. They say telangiectasias can emerge on the skin or inside the mouth, especially once the person with HHT reaches the age of 40. The telangiectasias may look like spider veins or tiny red or purple spots that turn pale or white when they are pressed. They may be confused with cherry angiomas or birthmarks. Now, I am not saying that every person with spider veins, and we've all seen these, has HHT. Far from it. Usually spider veins are completely benign and they are not associated with any problems or risks at all. But when they are related to hereditary hemorrhagic telangiectasias, these spider veins can break. They can cause internal or external bleeding, sometimes even to the point of needing a transfusion. Given the frequency of this client's nosebleeds, I am curious to know if HHT might be part of her health picture. And I asked, but I did not hear back from our contributor in time to include an answer in this episode. Let's shift our focus now to any interface that might exist between TMJ disorders and the risk of nosebleeds. I will save us some more time. There is little to no data that supports any link between these two issues outside of a warning that nosebleeds plus jaw pain together can sometimes signal cancer in the nasopharynx. So is this person's TMJ pain somehow linked to her nosebleeds? I'll say maybe, because there is another intermediary in this mix that's related to stress, sort of like TMJ pain. Did you notice when I brought up hypertension a couple of minutes ago? The links between hypertension and epistaxis are clear. There's a demonstrable statistical correlation between people who have high blood pressure and people who get more nosebleeds compared to average. However, the exact nature of that correlation is not clear or agreed upon. It might be because high blood pressure puts more force on those delicate capillaries and the sinuses and the Kieselbach plexus. Or maybe it's because the stress of having frequent nosebleeds forces blood pressure up, so we get more nosebleeds. Or maybe it's that classic vicious circle, where one problem makes the other problem worse, which makes the first problem worse, ad infinitum. Regardless of which came first, the nosebleed or the hypertension, what would happen if we introduced some intervention that might lower blood pressure? Something like, maybe massage therapy? Here again is what our contributor said. My client has severe epistaxis. Originally, she came to me for TMJ. I didn't think much of the nosebleeds. I did some further research and I decided to put our sessions on hold until she gets a nasal endoscopy. She's had one cauterization. She still gets nosebleeds at least once a week, but they've decreased from the 3 or 4 times a week that she was getting before we started our work together. Prior to seeing me, those nosebleeds could last anywhere from 4 to 30 minutes and happen during the day. Now they only happen at night while she's sleeping. Do you have any suggestions? Well, now that I know a little bit more about nosebleeds, I don't have suggestions, but I do have some thoughts. The nasal endoscopy, where they send a scope inside the sinuses to take a look around, this is a good idea just to rule out worst-case scenarios like nasopharyngeal carcinoma or HHT. And at that point, they might decide that another cauterization is in order, which might put an end to these weekly episodes that occur during sleep. However, I have no opinions on bodywork strategy, with the assumption that this contributor is well educated in intraoral work. It might be useful to see if the timing of receiving TMJ therapy connects in any way to the timing of the nosebleeds, but nothing in the literature makes any correlation between these two issues. So if the client is making some progress and if things aren't getting worse, and she's been cleared from worst case scenarios with that endoscopy, I can't see any reason not to proceed. I also don't have any particular suggestions on how to continue. There's exactly nothing on PubMed or Google Scholar that puts these two concepts, massage therapy and uncomplicated epistaxis, together. But I have to tell you, I am curious. First, because I'm safety-oriented and I want to rule out anything serious up front, I would like to know if this client has HHT, or if she's been cleared for nasolaryngeal carcinoma, or if she has any other odd conditions that might encompass frequent nosebleeds. Next, I want to know whether she lives in nosebleed-promoting environmental conditions like dry air, low humidity, high altitude, or if her symptoms get much worse during allergy season. And lastly, I am really interested to know if she has hypertension, because that is the best through line I can see here. This is, I know, a reach. I have leapt from frequent nosebleeds to hypertension, this is not a clear pathway, to the suggestion that massage by lowering hypertension, again, not always a completely reliable claim, might help to reduce the frequency of nosebleeds. We have scattered data about massage having a positive effect for high blood pressure. And here's a client who's gone from 3 to 4 bleeding episodes every week to usually only 1. That's a big change. I'm not claiming that massage was the magic bullet here, but it seems fair to suggest that it might have helped. I'm so sorry, contributor, that I don't have further suggestions, except to look at the possibility of hypertension and HHT. Beyond that, I'm really sad that your client wakes up with a bloody nose so often. That sounds awful. I hope she gets some successful treatment for that. But mainly, I am really, really glad that she has found you. And I hope that you continue to work together to bring about improvements for her quality of life.
Hey, everybody. Thanks for listening to I Have a Client Who Pathology Conversations with Ruth Werner. Remember, you can send me your I Have a Client Who stories to ihaveaclientwho@abmp.com. That's I Have a Client Who, all one word, all lowercase, @abmp.com. I can't wait to see what you send me, and I'll see you next time. Hello, I Have a Client Who listeners, Ruth Werner here, and I'm so excited to let you know that my library of online self-paced continuing education courses has just expanded. I now have a 2-hour ethics course called A Doctor's Note is Not Good Enough and What is Better. This NCB-TMB approved course goes into why a doctor's permission or approval or even a prescription doesn't provide the legal or safety protection you might think it does. Then we look at how to start useful conversations with healthcare providers that will actually get us to safe and effective massage for our clients with complex conditions. Visit my website at ruthwerner.com for more information and to register for A Doctor's Note is Not Good Enough and What is Better.